So my name is Jen Budney, and I'm a professional research associate at the the Canadian Centre for the Study of Cooperatives at University of Saskatchewan here in Saskatoon. And I'm really thrilled to be talking to Len Usiskin, who's the Executive Director of Quint Development here in Saskatoon as well. Thank you so much for joining us, Len. I was hoping that you could introduce yourself a little bit more than I just introduced you.
Thanks, Jen. I'm really pleased to be here. My name is Len Usiskin, and I'm the Executive Director of Quint Development Corporation, which is a not-for-profit community economic development organization that works in Saskatoon's West Side core neighborhoods. And I'm also co-manager of Station 20 West Community Enterprise Center. And I've been working at Quint as the executive director since March 1998. So that's about 22 years, I guess, or so. And so I've been doing this work since that time. And
so this series is our Co-ops in a Time of Crisis series. We're focusing on social economy organizations this week. And I want to know, well, first of all, if you could briefly describe what Quint does and the community it operates in, but how has the COVID-19 pandemic affected your organization, your clients, and your community generally?
I'll start with what Quint does, and then I'll get into how it's affected us. We work on community economic development work in the core neighborhoods of Saskatoon. And that work generally focuses around affordable housing, transitional housing, and employment and training work and social enterprise development work. And we've been affected in various ways by the pandemic. Our offices are now closed. And so all of us who work in the office are working remotely from home right now. That's where I am right now. And we are providing for our employment services that those services are now being provided remotely by phone and by internet. For our housing operation, our affordable rental housing, obviously people live there, so that can't close down. So some of our housing coordinators are working from home as much as possible, but that can't. Some of that is essential work, so they have to come in, and then a lot of our caretakers are still having to work as we're trying to implement enhanced hygiene protocols at a lot of our buildings where the housing is, and making sure that there's safe social distancing there, and then our transitional homes are still operating as well, and because people live in those places as well, and so those staff are still coming to work every day as well, and we've incorporated enhanced hygiene and safe distancing protocols at those workplaces as well. So I would say about half of the Quint staff are working from home remotely, and half are still are considered essential services and are still having to come into their workplace every day. But regardless, we've heard from all of our governments that fund all these programs, or that all of our funding hasn't been interrupted. So we're able to maintain everybody is still employed. The only one that's been a little bit interrupted was our social enterprise, Build Up Saskatoon, which is a construction social enterprise. And it's not really essential services, so there have been 2 or 3 people there that have been laid off as a result. But we're actually we have actually got some suites that need renovating, so we're sort of gearing up And because even though there's a pandemic going on, there's still a high, maybe even an increased demand for affordable housing. So we're saying we need to get these suites back into service because there's a desperate need for affordable housing. So the build-up crew will be doing some renovation work in the next few weeks.
Well, that actually brings me to my next question. This issue of there being an even more urgent need for affordable housing. That seems like this is a big policy issue for the province right now. But has the pandemic brought to the fore any other policy issues relevant to the social economy, or can you expand on the housing problem?
Well, it's real. The pandemic has exposed a lot of structural inequities in our community, right? I mean, just look at all the low-income, insecure jobs that are now considered essential services all of a sudden, and everybody's saying thank you to grocery store workers and hospital cleaners and long-term care workers who have been exploited probably and for many years. And now all of a sudden we're seeing that, oh God, these folks are essential to carrying on our daily existence. So that's one, and a lot of that has raised the whole question about should we be talking about universal basic incomes in our countries? I know about 2 or 3 European countries are now seriously moving in that direction, right? And that discussion has been reopening here in Canada as well. So that's one interesting public policy discussion that's come about as a result of the pandemic. But it's also in terms of housing. I mean, all these public health measures that are being that our chief medical health officer is telling us to do, like stay home, self-isolate, self-distancing, social physical distancing, and enhanced hygiene, hand washing. Those are all if you've got good housing and a place to self-isolate in, then you can do that. But if you have precarious housing or substandard housing or no housing, or if you're homeless, then all of a sudden all these public health measures become highly problematic, right? And so the question is, how do you self-isolate when you don't have a house to do it in, or if you're having to live at a overcrowded shelter, right? And so the question that there's been a big response from community organizations that, because we've all had to sort of close our doors as individual organizations, but we all realize that the marginalized and vulnerable populations that we serve are now left with no services. And so we've all come together, but the big question is, there are people now presenting with symptoms of COVID-19, and how do we create self-isolation plans for them? They can't be taken in at these shelters, and so there's a big discussion going on about with the Ministry of Social Services about setting up hotels, and is there vacant affordable housing in the city that we could be using for homeless or people that don't have, or living in overcrowded situations. And so that continues to be a very dynamic situation as we speak, but it's really brought home the importance of safe, adequate, affordable housing in our community. The other big public policy issue is that people are seeing that jails, overcrowded jails, are becoming a hotbed or a hotspot for COVID-19 spread. And now they're starting to release prisoners that are, that they deem are not low risk prisoners, right? And so the whole question becomes, first of all, why were prisons so overcrowded to begin with? But then the question is, why are we incarcerating so many people? And what could be some alternatives that we could come up with instead of incarceration, like what we're doing with Build Up Saskatoon. Can we create employment and mentorship opportunities for people instead of throwing them in jail, right? And making them productive members of the community rather than just warehousing people in jails. And then the other one is, the federal government has announced the Canada Emergency Response Benefit, and they're paying $2,000 a month, which is significantly more than what people are getting on social assistance in Saskatchewan. And the question is, okay, well, how did they come up with that number? And if that's the number that they've deemed the necessary amount for people to live on, why is welfare so low? So significantly below that, right? So it's exposing a lot of really fundamental social and economic justice questions in our community, and we're hoping that these discussions will these questions will go on beyond the pandemic, right?
So that brings me to two things, Len. One was just the observation that the federal government seemed to be, and the public seemed to really understand the idea when we were just focused on the health impacts of COVID, that we need to protect our most vulnerable. That the first thing would be to protect our most vulnerable first. When we talk about social programs, things like social assistance, welfare, this idea that we really need to protect our most vulnerable first doesn't seem to be present, and it doesn't seem to kind of win over the public in the same way. And I'm wondering what your thoughts are on this difference, why we can have such strong feelings about protecting our most vulnerable from this virus, and we don't share the same thing about protecting our most vulnerable from the effects of poverty. And I mean, the programs as they began to enroll were so complex and so complicated, and it was clear that they hadn't actually ever put that much thought into what they would do in a situation like this before it happened. My other question, though, is there has been quite a lot of criticism of the Canadian Emergency Response Benefit from columnists like John Ivison in the National Post, talking about how this is a disincentive. This will be a disincentive for people to actually work, for able-bodied students, let's say, or others receiving. They would rather take the $2,000 a month than go out there and get a job. And you've had so much experience in helping people find employment. I'm wondering if you could comment a little bit on this idea of social assistance being a disincentive.
Yeah, okay, well, okay, I'll start with the first question, I guess. I think it all, like when you talk about vulnerable people, there seems to be it all depends on how you define what vulnerable people are. I mean, I think they would talk about people that, like elderly people and people living in long-term care homes, or people that are immunocompromised as being vulnerable people. And those are sort of, oh God, I hate to say it, but almost like the deserving vulnerable people. Now, and the undeserving vulnerable people are poor people and homeless people, right? But they're also very vulnerable, or people with mental health and addictions issues, right? Those would be, and so I would think that's where we run into sort of more resistance on solutions to protecting those vulnerable people, right? How do we ensure that there's appropriate housing and incomes available for poor people and homeless people and people on mental health with mental health and addictions issues. That those are long-standing questions, I guess, that we've been talking about for many decades, right? But in the midst of the pandemic, they're becoming much more critical and much more visible, I guess, those questions, right? So those are the frustrations, I think, that we're currently having in Saskatchewan with the Ministry of Social Services around how do we support those poor people and homeless people, right? And the second question about sorry, what was the second question again?
Disincentivizing work through benefits.
Oh, right, the CERB, yeah.
Mm-hmm.
Well, I guess, as somebody once put it, well, maybe we need to pay people better to begin with, right? I mean, maybe having people work at wages that are not sustainable for them is something we need to revisit. Mm-hmm. Like that's why I think the whole issue, there's a whole lot of discussion around the CERB has raised the whole question about making sure that there's a guaranteed annual income for mm-hmm. Canadians. Or maybe we need to revisit what minimum wage is and how do we ensure that if like the whole question about job insecurity and low wages at long-term care homes for people is become a big issue, right? That how unsustainable the whole long-term care system has become because it's been privatized and they're not providing secure jobs and wages that are sustainable for people, right? So I think people do want to work and they want to make a contribution, and I think it's not that the CERB is going to be. I can't see anybody who's going to. A lot of people are going to want to sit home and collect the CERB if they can get their job back, but I mean, I'm just trying to figure out what $2,000 a month equals about $24,000 a year, which is not really close to a sustainable income for, especially if you're supporting a family. Mm-hmm. And given that in Saskatoon, the average rent of a 2-bedroom apartment is around $1,100 a month, there's not a lot left over for all the rest of your monthly living expenses, right? Mm-hmm. So I think we really do need to think about how do we ensure that if people are getting sustainable, if they're going to work, they're getting sustainable wages and not part-time, not having to put together 2 or 3 part-time jobs to eke out a living, eh?
Mm-hmm. So has the pandemic shifted at all the way you think about what Quint does or what it will do in the future? Where has it shifted priorities in any way? Changed anything for you?
Well, we haven't. We're still reacting and trying to adapt, like a lot of. And what's the post-COVID world mm-hmm. look like? I guess, eh? Mm-hmm. So we're just trying to. We're still doing a lot of short-term reactive planning right now, but I think what is exposed to me, or what I'm finding, is that a lot of the issues that we've been working on over the years that we see are important to strengthening communities, like making sure that we have affordable, appropriate, good quality housing, and people have access to the labor market, and and that we have strong, vibrant communities are really important, right? And so I think the work we've been doing on community economic development and the social economy, it can be really informative to everybody in a post-pandemic period on how do we make sure that our communities are strong enough to respond to potential future pandemics, and how do we and all these structural inequities that have been sort of highlighted as a result of it. The social economy practices are really important tools to address some of those and resolve some of those issues. So I'm thinking that we continue to be part of the solution to a lot of these questions.
So you've been involved with the Social Innovation and Social Enterprise Fund, some of the preliminary evaluations, I guess, have been going on. To your knowledge, has the pandemic changed anything in that program?
Well, I haven't heard. I mean, there's been no. There was the first round. There was a preliminary investment readiness fund, which there wasn't a lot of money to begin with for Saskatchewan in that round, and I don't even think they just. I was part of the adjudication committee that just before we all went into lockdown, and I don't think even the successful organizations have been informed yet that they've gotten funding through that process. So it's really and I haven't heard about the longer term social finance, social investment fund. There wasn't a lot of details to begin with, and I'm not sure if it's being. I'm hoping they're changing, but a lot of people are talking about. I know post-pandemic, doing some post-pandemic planning. For example, there was a group out of the University of British Columbia that issued a statement on housing strategy in Canada for a post-COVID-19, and because the government is probably putting in place, what are they calling it, the economic stimulus package to restart the economies across the country, and people are realizing that housing is too important an issue, so they put forward a sort of a bit of a national statement on what needs to be incorporated into a post-pandemic national housing strategy. So that's good to see, and I imagine there's going to be similar kinds of things coming out in terms of probably in other social and economic sectors as well as housing. Housing is a pretty obvious one, though.
Now, the Saskatchewan nonprofits have really come together during this time to make its case to the Saskatchewan government about the need for housing for the poor and hard to house.
Yeah, well, you know, one of the interesting things that I found as a result of the pandemic, like I mentioned earlier, a lot of us had to close our doors. A lot of CBOs, community-based organizations, had to close their doors and are working remotely, which left this big gap in services for a large vulnerable population of low-income people in the city. And so right at the beginning, even before we were all shut down, there was a group of about 30 or 40 CBOs that started meeting to discuss this, you know, how do we collaborate to work together to ensure that these vulnerable populations are not being overlooked in this whole, in the pandemic planning. And so we started talking about housing was one of them, but how do we set up a service hub that would be safe for people, right? And where there would still be a resource place that people could go to access services. And what we're finding out at those service hubs, I think the one that's still operating is at White Buffalo Youth Lodge on 20th Street in Saskatoon. And that the two main areas of work that people are asking for is, when they come there, is assistance in finding affordable housing, mm-hmm. and assistance in getting social assistance. And we're helping them navigate Ministry of Social Services income assistance work, right? That's the two main areas. And then, and now we're finding out that and people that are, and what are we doing with people that are presenting with symptoms of COVID-19, but and therefore can't stay at a shelter? So we're trying to troubleshoot what that looks like, and now even more so, we're working on, as justice releases all these people from provincial jails, where are they going to be housed, and where are they going to live, and mm-hmm. what are the supports in the community for them? I mean, it's really easy for justice to let people out, but now, but they don't have any resources at their disposal. So we're all scrambling to figure out housing and resources for those folks too. So that's really the work that's going on in an interagency community response.
So for anyone who has never applied for social assistance, they may not understand that it isn't actually always an easy process. There's a lot of paperwork and a lot of different kinds of documents you need to gather, and some of those documents can be hard to find too.
Well, yeah, and not only that, but it's mostly an online process right now, and all the sort of the places that people would rely on to mm-hmm. access the internet, to like libraries or our resource center or any other resource center that offered people access to computers and internet, they're all closed. And so it's really created this sort of a paradox where to access it, you need to do it online or do through the call-in centers. But some people, there's been reports where people have been waiting for 6 to 8 hours just to access the call-in centers. So it's really become problematic. So I don't know, those are a lot of the discussions that are going on with the Ministry of Social Services right now, is how to, and accessing all the documentation that you alluded to as well. Mm-hmm. So it's complicated, right? And so we're trying to support people in those processes. But those are the big issues that people are looking for support with right now. And to some extent, our team, although they're working from home, are helping people accessing some of the emergency response benefits and advising them on what's available. And our office is putting out a list of resources that are still available in the community, and that's being updated every couple of days. So we're trying to get that out there as widely as possible to all the different agencies in the community. So there's a lot of work like that going on just to make sure that information is getting out there and for people so that they can access it.
And so do you think that through this crisis that policymakers are coming to have a better understanding perhaps of the role of social economy organizations and the nonprofits who are filling in these gaps? Many of the things that you're doing seem to be things that one might expect the government itself to do.
Well, that's been, I think that's been a shift that's been going on for many years. Has been a shifting of delivery of social services to the community-based sector, right? And governments have been removing that responsibility from themselves and relying on the community-based sector to do that. So that's nothing new, I guess. What's new is that it's been shown as how under-resourced the sector really is, and how we've been making do with really pocket change, you know, and really, if we wanted to, and groups have been sort of identifying too that their whole the pandemic has put the financial health of their organization in jeopardy, because they can't do their fundraisers and their big galas and all the rest of those things. And the question is, how are they going to sustain themselves and their services going forward? We're not in that situation, but I've heard a lot of different other organizations that rely on fundraising are.
Yeah. Quint is much less reliant on fundraising than other organizations.
Yeah.
And then once we come out of this, of course, there's the inevitable recession. So there's some chance then that there will be much fewer donations as well.
Yes, and the need for our services is going to be greater. So that's
right.
Sort of the perfect storm. Is the ability, the needs on the sector are going to be greater, and our ability to meet those needs is going to be decreased, right? So so that's going to be a big, probably a big discussion that's going to be going on, I would say, over the next, well, it's begun already, but over the next year or two. And who knows how long this we're going to be in this, in dealing with the pandemic, right? It could be for another year or 2 years, you know. Yeah. So that's another big unknown that we're all trying to figure out ourselves too, right?
Sure is. I don't know if we can figure it out. I think this is a time when we have
we don't know.
Exercise a lot of patience.
Yeah, and be really responsive and flexible. But what we would like to see is a much more progressive sort of response from our governments, right? And not reactively, which it seems like, especially Ministry of Social Services, could be much more proactive in their approaches to working with us at the community level, and we're not really seeing that. I think people are feeling that there's feeling quite a bit of frustration right now, that it's kind of like, in a lot of cases, it's almost like business as usual. But again, it goes back to that question about because we're really talking about the undeserving, vulnerable populations here, the so-called undeserving populations, right? Anyways, you know, I mean, even with the deserving populations, like seniors living in long-term care homes, and like it'll be interesting to see how policies around long-term care change in Canada as a result of this, and how we support public health and our healthcare systems more sustainably as well, right? There's going to be a lot of interesting discussions on the other side of this, I think.
So do you see any, are you in any position to even imagine some longer term implications for Quint Development at this time?
I mean, longer term of the pandemic?
Of the pandemic.
Well, you know, it's going to be, I mean, I've just been talking with my colleagues around the Reopen Saskatchewan plan, and what does that mean for us in the community-based sector? Well, we're not mentioned in the sector at all, and so we're trying to scratch our heads and going, well, what timeline is it for us? But even if we, you know, we're probably not looking at doing any reopening until the beginning of June, and maybe even beyond that. Well, we're just following recommendations from public health. Basically, But even if we do reopen our office or our phase in a reopening of our services, we're trying to imagine what that would look like, because it wouldn't go back to what it was before. And so basically right now I'm saying to people that, if you can do your work from home, that's where you should be doing it from right now. Even if you do move towards a partial phase reopening, that would only be for services that couldn't be provided from home, right? And so, and we're talking about, how do we make physical alterations to some of our places as well, to just ensure that it's a safe, we're providing a safe place. But that's, but if you're talking about longer term work, I mean, the whole question about, to me, the whole question about the need for more affordable, good, high quality, affordable, appropriate housing has become even more urgent, as if we didn't think it was urgent before. We did, but it's become even more of an issue for us. And the whole issue about sustainable wages and livelihoods, I think, are going to become areas that we really need to put more energy into. And what that might look like, whether it's a guaranteed annual income or universal basic income, or and how those might work, and what might be the implications of those, are all areas that I think, and of course, shelters, how unsustainably they're funded right now in our city, and how do we deal with homelessness in our city? How do we implement better policies for mental health and addictions, people with mental health and addictions? And definitely, how do we make harm reduction policies more accessible, more available, and accessible? We were all really disappointed to hear that the provincial government wasn't, this is before the pandemic, wasn't going to fund the operations of the safe injection site at Aid Saskatoon. It was proposing, right? But those kind of issues now become even more, more urgent, I guess, as a result of the pandemic. I mean, it really shone a light on how the response to the pandemic has not been, and the recommendations can't be accessed universally, right? That some people just can't, need more support and different programs, right? So those are a lot of big questions, right? I don't know if can't give you any specifics on where they're going, but that's just some really preliminary thinking, I guess, I'm thinking about right now, is housing, guaranteed annual incomes, shelters, homelessness, supports for people with mental health and addiction issues. Those are all really critical issues right now. And alternatives to incarcerating people, right? Like, how do we scale up? How do governments invest more in social procurement so that it can support the whole issue of social purpose businesses, social enterprises, so that we can create alternatives for people to invest upstream instead of putting people in overcrowded institutions, right? So there's lots of work to do. That's for sure.
So it seems to me, in dealing with this crisis, just as in dealing with the issues that you face outside of the pandemic, that there's some real strengths to community organizations being taking the lead in delivering services and programs to people. They can be more nimble. They know their communities better. they can be more responsive, more culturally appropriate, all of these things than it would be if government was delivering all these things centrally. But the real problem is funding. Am I getting that right, or are there other problems with the government having offloaded delivery of services and programs to the nonprofit social economy sector?
Well, I think fundamentally, as a community economic development organization, we believe that decentralized delivery of services that are community-based and that are tailored to the individual needs of a specific community would be better than sort of one-size-fits-all excuse me, government supports. But the big question is, governments have to also support that notion, right? And figure out how they can support the sector to do that kind of work, right? So if they're offloading onto the sector, hopefully they're doing it for the right reasons, which is that they also believe that the community-based sector can provide services that are better meet the needs of the community, but that they also understand that they need, that we need to reallocate resources to do that. And not only that, but if we can do that, if we can work on some of these upstream work, that it's gonna, to them, it's gonna save them money overall, because it's cheaper to do social procurement. In other words, buy goods and services from a social enterprise that's going to employ people that have criminal records, rather than having high recidivism rates and building more jails, right? Jails are the most expensive form of housing you can imagine, right? And the worst form at the same time, right? Super expensive and terrible housing, and yet they could support social enterprise not by increasing funding to organizations, but just by changing the way they do business, right? By putting a social lens on their procurement policies and saying, okay, we're gonna buy, we need to buy goods and services X and Y anyways. Let's make sure that we're supporting communities when we buy those goods and services, right? It's a bit like others who advocate we need to support local companies when governments are doing major infrastructure projects, right? Why tender out a project to a company that's from a different province and bring in all these workers from outside when we should be employing and giving the jobs to people in Saskatchewan? It's the same sort of lens that you want to put on it, only a social lens on the procurement process as well.
And now there's been a social procurement policy adopted by the city of Saskatoon quite recently, has there not?
Yes. Well, it was adopted by City Council. Always these things are, we haven't really seen a lot of it translate into rubber hitting the road on the ground yet, because I think it's the challenge now is for how does administration make that work, because they've got their policies and procedures and their tried and tested suppliers that they've worked with for many years on all these things. And so I think the question is, how do you take the large policy and then implement it at the administrative level, right? And so, yeah, so that's another piece of work that needs to be done. But we're hopeful. At least there's some political leadership on that front from City Council
Mm-hmm.
And now I think the work that needs to be done is to keep the pressure on so that we can see it actually translated into actual procurement practices by the procurement office at the city, right?
Mm-hmm.
So yeah, hopefully that can be done, or encourage their providers, like putting a social lens on their tendering process to, so if they want to be the successful bidder, there has to be some social benefit that they can
Mm-hmm.
demonstrate, right? So that they, maybe there's some construction company that can partner with Build Up Saskatoon, for instance, right? And so that we can create jobs for people with criminal records and former gang members, while some company is meeting some procurement need from the city, right?
Mm-hmm.
So those are the kinds of things we're thinking about there as well. But
So,
this has been going on before the pandemic.
mm-hmm. And the province isn't
But they're
anywhere close as far as, to.
well, they don't. They like the idea, but they're not. I haven't seen any signs of them uh, creating any sort of formal legislation or regulation or policy around social procurement. Right? There's been this. Everybody I talk to in government likes the idea, but and they think it makes a lot of sense, right? That you're having to buy goods and services anyways. Why not? If you're spending the money anyways, why not spend it and get the double bottom line, like the social return? And the governments are typically the people that see the social benefit or the social savings on social procurement funds. So they're the ones who directly benefit from it.
Mm-hmm.
So they should be the ones most motivated to introduce it and implement it. But so far we're not seeing a lot of. We had some good talk at one point from one of the deputy ministers of injustice around creating employment for people, gang members and stuff, but it didn't translate into any real shifting of resources or any real procurement policy changes at the provincial government level.
Mm-hmm.
So I'm not sure how that, yeah, there's somebody, we do need somebody to be taking that on and being the squeaky wheel in government to really be pushing that agenda, because
Mm-hmm.
I think they support it, but they just need to be constantly being pushed, right? And reminded about how important it is.
Mm-hmm.
And that
So,
the status quo is really costing them a lot of money.
yeah.
And we can show them how they can save money if they do things differently.
Yeah. So my last question for you, because we're running out of time. What's I know some of the subjects that you want to bring to the fore. Is there anything else you want to say about your hopes for possibilities after the pandemic for the social economy, for the nonprofit sector?
Well, I think the sector provides a roadmap, I would say, for dealing with a lot of the structural inequities that have been highlighted by the pandemic, right? How do we create stronger communities that are, and how do we ensure that vulnerable people can practice public health measures appropriately, right? And because they have adequate affordable housing or whatever. So or that people are not marginalized from labor markets or have adequate incomes, right? So it's really the community economic development and the social economy sector that's been doing the work, the innovative work over the years to help to create those conditions, right?
Mm-hmm.
So that's my hope, is that the sector can really make major advancements as a result of the pandemic. As somebody said, we shouldn't. It'd be a shame if we waste a good crisis, eh? Not learn from the lessons that we're finding out as a result of this, right? And just go back to normal, which was not sustainable for a lot of people, right?
Mm-hmm. Good. Well, that seems like the right point to leave off. We're hoping with this conversation series that we can create some kind of record of the ideas that have been circulating through this, so we can go back and get the right research done and get the ball rolling on some of these ideas.
That'd be great. Yeah.